Thank you, Chair, and can I say thanks to all delegates. We've had some fabulous and very impassioned speeches, but particularly thanks to Poole, Weaver-Vale and Bladen for seconding the motion and supporting the motion on social care. It is an honour to close this debate as Labour's Shadow Cabinet Member for Mental Health and Social Care. I'm proud, really proud, to have that role in a Labour Party that understands how vital mental health and social care services are, and a party that makes protecting those services a major priority. And doesn't it need protection? We've heard in this debate it's even more important when we see the crisis the Tory government has created in both social care and mental health. And as Nick Forbes said, it's a crisis made in Downing Street. The Tories are failing people across the country. They're failing those who need care and their families. They're failing unpaid family carers. They're failing hundreds of thousands of care workers. People are now going without the care they need. Nearly 500,000 people fewer getting publicly funded care since the Tories came to office. 500,000. Over 1 million older people with unmet care needs, many of them isolated and lonely. The Poole CLP delegate told us about the person with Alzheimer's, lonely, looking after himself with unmet needs. But this Tory government isn't just failing social care users, it's failing their families too. Hundreds of thousands of unpaid family carers are now struggling to balance work and care. And it's failing hundreds of thousands of care staff, because under the Tories, too often they are underpaid, undertrained and undervalued, and that's not acceptable. Caring staff who are forced to work on 0-hours contracts, denied pay for travel time, underpaid for sleep-in shifts, with care visits of just 15 minutes, prevented from giving the quality of care which people deserve. And the Tory government is failing children and young people in need of mental health services, now denied treatment due to Tory cuts. Young people told they are not thin enough to be treated for an eating disorder. Children who have self-harmed being turned away unless they have made a serious suicide attempt. Thousands of people in mental health crisis being sent hundreds of miles from their families just to get the treatment they need. Mental health services for young people that are now so poor. A High Court judge had to tell Jeremy Hunt that this country would have blood on its hands if suitable care could not be found for a suicidal teenage girl. Conference, it's time for us in the Labour Party to say that this is not good enough. It's not good enough that care quality has fallen, and we've heard in the debate examples of that. 1 in 4 services are now failing on safety grounds. It's not good enough that thousands of vulnerable people are stuck in hospital for weeks or months because there is no care for them at home or no place in a care home. It's not good enough that last winter the British Red Cross talked of a humanitarian crisis. They saw people sent home from hospital without clothes, people falling and not being found for days, people going unwashed because there were no care services to help them to wash. This social care crisis was made in Downing Street, and as we heard, even though it was the Tories that led this, the Liberal Democrats aided and abetted the cuts from social care. Tory governments working in the coalition started cutting billions of pounds from council budgets, and Tory ministers are now failing to find the extra funding needed for social care. Failed budget after budget after budget and autumn statement after autumn statement. And then during the snap general election, Theresa May announced her solution to the crisis. What would it be? A new tax on care, dubbed the dementia tax, hitting people who need care even harder than they'd already been hit, making people use the value of their own homes to pay for home care. Now, this was such a failing and toxic policy that Theresa May announced a U-turn on it within 4 days, and then the Tories quietly dumped that policy. But in its place, the Tories now have nothing to say at all on the future funding of social care. They just promise what? They promise a consultation and a green paper. And on the crisis in mental health for children and young people, which so many in this hall clearly really are very concerned about, they also promise us a green paper. Conference, Labour will fill this Tory policy vacuum. We will show that we are the party that values social care and mental health. And it has to start with the extra funding, which Nick Forbes said that councils desperately need. At the election, we pledged an extra £8 billion for social care in this Parliament, with an extra £1 billion this year to deal with the Tory crisis. This would have delivered, it's important to what we were trying to do with that £1 billion extra this year. This would have delivered paying a real living wage to care staff, paying them travel time and letting them choose regular hours. And that has to be just the starting point for our care staff. It would have delivered finally ending inadequate 15-minute care visits. And it would have helped to ensure free end-of-life care. We had pledged free end-of-life care in 2015, and we pledge it again in 2017. And importantly, Conference, Labour believes funding must be found to pay care staff properly for sleeping shifts. And I really want to thank Unison for all the work that they've done in supporting our care staff. Care staff who provide those sleeping shifts have to be paid properly. And Labour will support family carers. We have pledged to increase the carers' allowance for unpaid carers to at least the same rates of job seekers' allowance. That's only a small first step. We have to recognise the value of the work of unpaid family carers. And Conference, a Jeremy Corbyn Labour government will build a national care service. A service in which we pool the risk of high care costs so that no one is faced with catastrophic costs as they are now. In its first years, our National Care Service will receive an extra £3 billion in public funds every year, enough to place a cap on what individuals have to pay towards their care, enough to raise the asset threshold for paying for care, enough to provide free end-of-life care. Now, to act on our pledge, we will invite an independent expert panel to advise us on how we move from the current broken system of care to a sustainable service for the long term. Finally, in mental health, we will increase the amount we spend on services for children and young people. It is a crime that despite their numbers, a very small proportion of mental health budgets do get spent on children and young people. And more importantly, extra funding keeps being promised. We will ring-fence mental health budgets so that money isn't siphoned off by other parts of the NHS. We will bring an early end to the savage policy of patients being sent hundreds of miles for mental health treatment. And we will offer school-based counselling for young people in every one of our high schools. And I really thank the delegate who raised the value of school nurses and health visitors. Counsellors would really help in that grouping of health visitors and school nurses working with our young people. Conference under the Tories, we have seen years of neglect of care needs. Neglect of older people, of younger people, of vulnerable disabled people. This Tory government has now no solutions to the problems it has created. Only Labour will end this crisis made in Downing Street. Only Labour will bring hope to those in need of care and those who care for them. And only Labour will build care services fit for the many, not the few. Thank you, Conference.